time for another edition of Wellness Wednesday with Dr. Bradley Meyer of Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave. Glad to be here.
Hey, we have some success. You have some success stories to talk about today. We're going to start with a patient that came to see you with some high blood pressure.
Right. You know, this is such a blessing to be part of folks' wellness walks, getting them feeling better and on less medication. And this was another story of a gentleman that came in with some pretty high blood pressure and fatigue. Just afternoon, felt like he needed to take a nap, and he felt inflamed. And I think a lot of us, as we get older, at times in our lives, you just can tell when you feel inflamed. You're not on your game. Your brain's slowing down. You're not feeling real sharp. And so he's like, I really want to hit this without doing blood pressure medication, if at all possible. And he was in a zone where his blood pressure wasn't a high risk zone, so we didn't need to temporarily put him on some blood pressure medicine. And we did a full comprehensive history on him. He sat down with me probably for a good hour on the clinic, and we went through his history and did a good exam with him. And we got going on a game plan, and really what it came down to for him, and it's typically a stepwise approach because there's a lot of clues when I take a history of where we need to start, but we really work to support not only his digestion but his vasculature and his brain, because all of those things are connected. And so we've got a combination that works really, really well for a whole host of chronic disease states to get the body into this state of healing. And we got him going with that, and he made it through the holiday season, and I think it was about 5 to 6 weeks later he came in with that, having implemented that regimen. Blood pressure had gone down 20 points on that top number side and bottom number side. He's like, oh my goodness. He's like, I've got more energy now. The bloating that I was feeling in my belly and my abdomen is improved. And so then we took the next step. So we're going to follow up with him again next week, because it's a building process that we go through to support that body, the brain, the digestion. And things that we sometimes will look at is, what do your good fats look like? That's an important thing for your blood vessels, to make sure that they're not getting hard. We want them soft, so that the blood pressure is staying in that range that we want. So, we're well into a good wellness walk with this young man, and I guess I call him young because I'm 46 and he's in his 40s as well. But we're getting him feeling younger, because when he came in, he's like, just feeling like older than his age represented. So a great story for what is possible, because a lot of times folks, we can start on blood pressure medication, which is going to lower our risk for heart attack and stroke, but a lot of times in the process, we're still feeling inflamed. We're still feeling no energy. So what can we actually do to help get the blood pressure down? So maybe we don't need the blood pressure medicine or as high of a dose. That would be the game plan when you come in with me. So, or if you say, I like Okoboji Wellness Clinic, and I just want to come there, and I'm good with that blood pressure medicine, and it's working for me, then that's good for me too. So I want you to make sure that you know that there are options out there for different paths forward for your health care.
And we've talked about this. It's been some time, but a lot of times you start on one medication and something goes a little haywire, then you end up with another medication because of maybe a side effect from the first medication. Now you're on 2, maybe 3 medications, and initially, you were just hoping to maybe drop the blood pressure a little bit. Now, all of a sudden, you're on 3 medications. So, as a patient, that can get really frustrating.
It can, and so that tends to be the pattern. I certainly at one point was on a couple of medications myself, and one for my heartburn, and then that eventually led to decreased absorption in my gut and low iron, and then all of a sudden now I have restless legs. And when then I was on a restless legs pill. I don't have any of those things now. So just it's possible to work yourself back from that multitude of multi-pill, or we call it polypharmacy, essentially lots of pills. So
yeah. Okay, another cool story, and this is a really cool story, and this one actually involves maybe an unintended consequence out of hyperbarics.
This is so exciting. I mean, I just get goosebumps right now when I get to talk about it, because I had goosebumps on Monday morning when this gentleman came in, and history of cancer in the mouth, and had some radiation to that area, and we were hoping to stimulate some stem cells to do this before a surgery upcoming. His specialist said you need to get some hyperbarics going so we can stimulate stem cells, and it's going to help you recover from your surgery. I totally agree with that approach. It's very good to do before and after surgery, hyperbarics. But he didn't even mention to me this other thing that had been bothering him for so long, and he just gotten used to it. But he comes in Monday morning, and he actually spit, and I mean, it was amazing. He's like, Dr. Meyer, for 10 years now, ever since radiation, I have not been able to produce saliva. So he's had dry mouth for 10 years, and I think he was about 8 treatments into hyperbarics for this stem cell stimulation, and he's producing saliva again. What a big deal! I mean, so he is able to. Until you don't realize how important some of these things are from a daily life function and just quality of life thing until you lose it. And for him, you lose that to have that dry mouth, having to suck on a lozenge all the time to try to stimulate it. Well, the hyperbarics, what actually is happening with that is that nerve was injured by the radiation, and that's kind of one of those side effects. Well, when you hit it with hyperbarics, you're increasing oxygen and energy voltage to the area, and some of those injured nerves get revved back up, and they start working again. Some of those ones that were not fully damaged to the point where they were incapacitated or couldn't work at all, and so they started to supply, that nerve that was injured started to supply that salivary gland again, and then hence produce saliva and no longer have dry mouth. So, I mean, big deal. That was the start of my week, and I just was pinching myself. I'm like, wow, this is so amazing to have this blessing, this opportunity to get to work with folks that have battled some chronic stuff, that think that that's just going to have to be something I got to live with. And so that's, I mean, so get back to offering that hope. We always have hope that there are things that can be done to get the body into that state where it wants to be. It wants to heal itself. So we do some things here that are going to help make it easy for that body to get rid of toxins, things that have put it into a compromised state. We want to work with you to improve that quality of life. So it's a journey together that we go on, and again, just that made my month, that story right there.
Yeah, for that patient, it's life altering. I mean, I just can't imagine living like you have sandpaper in your mouth for 10 years and then 8 treatments into hyperbarics, you're producing saliva. That's just crazy. But that's so wonderful for that patient. Dr. Meyer, how can folks find you and come visit with you and come see you and get on their own journey with you?
Absolutely. Yeah, it's 712-339-6024 is our phone number. You can find us at OkobojiWellnessClinic.com. You can get in for the monthly membership where we're helping manage your primary care, and that's for the individual $99 a month, for the couple $179 a month, longer appointment times and unlimited visits. And that is a great deal. But if you prefer to just come in for individual visits, routine consults to talk about, hey, I'm bothered by this, whatever it may be, blood pressure or dry mouth or pain or brain fog, what can we start to do to work on that? Then we can get you going just with the first visit and go from there. So we're right next to A6 Hardware in Spirit Lake off of Highway 71, right behind the Okoboji's Pancake House there as well. And a couple other teasers, because we've just had a couple really good success stories come in droves. And I'm going to touch on this in the coming weeks, is wound management when it comes to healing up a chronic wound that might be there. So we've had some really good success there. And the other big one was a young man. How many young kids have rashes, and then rashes that just stay and stay and stay? And we're like, what do we do? They end up on Zyrtec and antihistamines. And this poor young man, 3 months of a rash that I can't wait to share that story, what we did with him to get that rash to go away. So lots of exciting. These are the things that really make my job fun, and so I just want that for more people.
Yeah, absolutely. I'm anxious to hear that story. I've got a young grandson that I saw looked like he was completely dressed in hives. So I'll be interested to hear that one. Well, Dr. Meyer, thank you so much. Have a great day. We'll chat soon.
Sounds great.
Thank you, Doctor. Dr. Bradley Meyer, Okoboji Wellness Clinic. You can also find Dr. Meyer online, okobojiwellnessclinic.com.